as this hot weather continues in the Midlands and across the country, there are some steps that you need to take to make sure that you stay healthy in this heat.
Yeah, joining us right now is Dr. Davis Thomas Ford from Prisma Health. Dr. Ford, thank you so much for being here today.
Thank you.
I want to begin with what new information we learned in the last hour. We had an umpire from Sumter County who died over the weekend. It was just confirmed that it was from signs of a heat stroke. His family said one of the last few things he said to them before he passed away was just how overheated he got at that game. What are some signs that people can look out for when it comes to heat illnesses?
Yeah, excellent question, especially this time of year. There's three main phases with heat-related illness, and you don't want to wait until you get to the final phase, heat stroke, to start treating yourself. The first phase is heat cramps. When you feel warm, you sweat a lot. You'll start to sometimes feel cramps. Usually it's in the calf and thigh muscles, sometimes the back and arm muscles as well. And the next step is heat exhaustion, where you, as the name says, you're heating up more and you become exhausted and tired. Some point along this continuum of heat exhaustion, you'll stop sweating, and that's a really dangerous point. And then the final point is heat stroke, which is basically neurologic symptoms. So in other words, weakness in an arm or a leg, inability to speak, not seeing or hearing clearly. One of your neurologic senses is affected, along with a core temperature of 104 degrees or greater. And at that point, you're extremely sick. 911 needs to be called and you need to go to a hospital. But I'd rather people recognize the heat-related illness earlier when you're having the heat cramps, and in the heat exhaustion. You certainly need to start treating. But I like to even treat before the heat cramps set in.
Well, you know, and we've been talking, you know, every time we toss to the weather and pitch, you know, I would keep reminding people, stay hydrated, stay hydrated. But the question is also, what do you drink? Because we have so many of these sports drinks and liquid IV and Gatorade mixes and, you know, body armor and all of these things. Some of them have a whole lot of sugar, which might not be the best thing to be drinking when it's so hot outside.
Yeah, absolutely, Ms. Katzen. A very good question. And I like water. A lot of people go with a different sort of way of going about this, but I say it's okay to have 3 liters of cold water, and then the 4th liter maybe something with electrolytes in it. I like something with electrolytes for that 4th liter, that 3-to-1 ratio, and just a little bit of glucose. Both Powerade and Gatorade make a low glucose conjoiner. Some of the other generic brands from Walmart and Kroger are also the same. I'd go with the lower sugar. The problem with having an energy drink or a sports drink that has high sugar is sugar's going to get filtered out in your kidney and it's going to pull free water with it. So you're actually going to lose some water in order to excrete that sugar from your body. But certainly none of those drinks that are energy drinks. Those sports drinks, yes, but water is good too. But none of those energy drinks. Caffeine makes you lose water and get dehydrated. Alcohol, some of those drinks have alcohol in them. Alcohol is a diuretic. It makes you urinate more and lose more water too. So just electrolytes and just a little bit of glucose in that sports drink.
That makes a lot of sense.
What about milk? I saw an article floating around today that milk was also good hydration in the heat, but wasn't quite sure about that.
Yeah, absolutely. You're right. Cold milk is a good way to hydrate yourself, get protein on board, which is always a good thing. It's not especially high in glucose. It's got a lot of other things that you need in it, vitamin D and calcium too. So yeah,
wow.
I'm a big milk lover. Milk is it's a superfood.
Well, listen, we see this stuff on social media, and I'm like, I'm not paying attention to that, but now we know. So thank you for that, Dr. Ford. Let me ask you about this situation yesterday. We were talking before you came on air about the lightning strike out at Lake Murray, which was a terrifying situation. It looks like everyone is going to be okay, but you said you've treated patients who've had lightning strikes that were far away from any severe weather, clouds even in the sky.
Yeah, absolutely. And at Prisma Health Richland, we're the big university hospital trauma center. I always joke that we're the place where the helicopter lands.
Right.
So we'll get to see some of the most interesting cases in the Midlands. So we're a pretty good barometer of what interesting stuff is going on. And yeah, this one particular case, it looks like the storm was 10 miles away from where the lightning strike occurred.
Wow.
That struck this person. And they stopped breathing. Somebody on the scene knew that one of the most common ways that people pass away from a lightning strike is it's not necessarily the heart arrhythmia, making the heartbeat funny or stop beating, but rather the heart keeps beating after the lightning strike, but it paralyzes their diaphragm muscles, which are required to make you breathe.
Wow.
And so it paralyzed this person's diaphragm muscle. The friend that was with them was an RN, was a nurse. She started doing mouth-to-mouth on the patient. 15 minutes later, he started breathing, but by that time, EMS got called. And she saved this fellow's life that got struck by lightning.
That's incredible. Wow. That's incredible. That's what I was wondering. What kind of damage? I mean, obviously a lightning strike is serious, but what does it do to the body, and what should people do on scene? You know, if you're concerned that happens. I mean, we've got swim meets all over the Midlands, you know, and all these other activities.
Yeah, I think anytime lightning is in the area, I get out of, I get away from trees, I get indoors. In a car is better than being out away from a car. It is true that the rubber on the tires and the overall car will act as a pretty good insulator.
Yeah.
But get out of the water and definitely don't be hanging on to something metallic. I think that was the problem with the people in Lake Murray, is they were in the water.
Yes.
And they were hanging on to a metal line or a metal buoy, and metal is a really good conductor of electricity. And the good thing about the lightning is it's instantaneous, it's really quick, it's not a prolonged current like what can happen when you touch a wall, high voltage outlet.
Yes.
It's just a quick instantaneous milliseconds exposure, but it's lots and lots of amps, lots and lots of volts. And so the injuries, to answer your question, are to the skin first. You get burns on the skin, you can get this thing called ferning on the skin, which is sort of a sign that the person, if you find somebody that's unconscious and they have that look of ferns, they probably got struck by lightning. It can blow out their eardrums, so they might not be able to hear afterwards. It can cause neurologic symptoms. It can throw them, and so they can have blunt trauma for getting thrown into a tree, onto the ground. And then it can cause muscle breakdown. It can cause the heart to go into an arrhythmia, which is the heart is not beating like it normally would, so it's not pumping blood to the parts of the body that it needs to in a concerted way. And then, as we talked about, it can paralyze the diaphragm, so that bellows apparatus that makes your lungs work is not working, and you'll asphyxiate to death.
My goodness.
Yeah.
Wow.
How lucky for those survivors
Yeah,
from yesterday.
absolutely.
I mean, wow, just listening to that. Dr. Ford, thank you so much for joining us today. We really appreciate it. Good information and good details, and we'll make sure to have this interview online at wistv.com.
I was going to say, I think we're going to make you our resident medical expert. This
Yes.
was fascinating.
Oh,
It's such
yeah,
great
it's my
information.
pleasure.
We appreciate it. We'll have you back again soon.
Okay, thank you.
All right, thank you so
Ms.
much.
Wisconsin. Thank you both.
All right, we'll be right back.